As the 3 years ago.
Okay, so just punch the gut out and
the week before that. Okay.
so this is a Senate Appropriations Committee, and this afternoon is going to be relatively short. It's just a matter of sort of touching bases.
Senator Westman.
Getting organized. Senator Westman is with us. Well, you're making a point too. So first of all, we have 2 new staff members, and so we want to use this as an opportunity. Can you sort of introduce yourself and a little bit about yourself?
Sure, absolutely. So Amy Pope, and I will be sitting here supporting you, helping put together the budget, and worked in state government and executive branch for a number of years, so I have a little bit of experience of understanding how state government works, but definitely have a lot to learn. So I hope you'll forgive me a little bit when I need to do some research, but I will absolutely do that for you.
Did you work in finance and management?
I worked in finance and management in the budget office for a number of years.
With Jim Reardon.
With Jim Reardon.
Oh,
well.
So I have some experience in that realm, and I worked in the Department of Human Resources in classification and position management.
So did Jim train you?
Yes, I think that would be.
Then you're probably ahead of me.
Yeah.
And don't forget, Jim worked for me. So, welcome. And Hannah, do you want to introduce yourself?
Yeah, my name is Hannah Gottschalk. I will be your committee assistant this session. I just graduated from UVM last May. So this is, and then I was interning for Senator Welch for the past 6 months. So this is my next step post-grad. I'm excited to be working with you all.
Oh, thank you, welcome. Thanks. And why don't we go around and introduce ourselves for your benefit as well. Do you want to start, Bobby?
Bobby Starr, Senator from Orleans County. Welcome. You're with us.
Ginny Lyons, representing Chittenden Southeast.
And I'm Rich Westman, I'm from Lemoyne.
And I'm Jane Kitchell, and I'm from Caledonia District.
I'm Dick Sears. I'm from southwestern corner of Vermont, representing Bennington County and several other towns around the southwest.
I'm Andrew Birchlick, Washington District, which is in Washington County, plus Stowe, Orange, and another town.
I'm Phil Baruth, Chittenden Central District.
I can't believe they took the orange
So,
out of Orange.
Phil is our pro temp,
Orange
and
used to be
Andy's
different.
our vice chair. Yes, Orange used to be part of the
Orange
Caledonia
has never
District.
been an Orange District.
No,
It used to be.
It used to be.
This is
2010.
ancient history.
2010, there was, we did some things that
In the village. I live in Allen.
I somehow ended up as chair of the redistricting committee. And the big issue was taking Orange out of Orange. Actually, it was 2000.
It was right after civil union.
2002. And so people came to a public hearing with oranges.
Like keep orange and orange.
Orange. And it was quite the battle. And that year, Walt Freed was the speaker, and Peter Schoenman was the pro tem. And it took us until Flag Day to get out. June 14th, we adjourned.
That was one of the longest.
I remember going to the last week of June, and then
Yeah,
since I've been here, we
28.
actually had a budget, remember? The last week, we were right down to July 1st, which gets us to the reason this committee exists, and that is to get a budget out. And I just want to let you know that the administration is going to present the budget adjustment to the House Friday morning. What I've got is Amy's just going to give us a run through first thing Friday afternoon. It won't take more than an hour, so just the highlights of what the budget adjustment is as proposed. The last time, there are a lot of things that have to be addressed in the budget adjustment. Remember, we took the money out of the broadband match to fund the gap, and there are a number of other areas where we've got to address higher spending. So the list, last I knew, the list of things needing to be adjusted exceeded what we have for revenues by a couple $1 million. So it just gives you a sense of kind of the fiscal reality or constraints under which we're going to be working.
So the administration is just presenting,
In past years, actually, they've
they
presented
started in December.
and the House had taken testimony in December to get it moving. Diane Lamford, Representative Lamford's goal is to have it finished by the time the governor does his budget speech, which is scheduled for the 23rd.
Which is tight.
Which is tight, and I don't know, but you know, you can have your, certainly, if there's a little slippage. So I just wanted to let you know that our plan is what the dates are, what we will start working on the budget adjustment like we always do concurrently, so that we're, once the House passes it, we can move it out pretty
We might be
quickly.
able to move it faster.
We've done that before, remember, but it was hard to pass a budget bill before the House. So that, and the other thing is, if you've been looking at the press and you've been seeing emails, the proposals for spending money or new programs or what should be done, and all of us have probably had meetings over the course of the summer from different organizations in terms of what they would like for financial support. We're gonna have to keep track of that like we always do, and we're gonna just have to prioritize. The other thing that I think will be very helpful, and I just want to remind people of it, we asked a number of years ago to put together a report calling our unfunded obligations, because everybody coming in here pushing for something new, we're having to measure how well are we doing with our obligations we already have in place. And underfunding, and they have been significant. Obviously, pensions are right there at the top of the list, but we've got a plan. As long as we hold to it and fund the plan, the minute you slip back into underfunding. But certainly our Reach Up program, when we talk about poverty and children, I don't know what our grant amounts are right now, but I think it's around 800 a month. And we have all this rhetoric around, you know, poverty and the impact on children. And yet here's a program, if we were to look at, if we use the standard of need, we would need $27 million more to fully fund the standard of need. So I think it's important that all of us look at what we have for obligations around programs that we have now. VHCB, housing, everybody's talking about the importance of housing. We do not fully fund VHCB according to statute, we notwithstand.
We did last year.
No, we brought it closer. I think we're still 9 million of not withstood. But the governor had removed the 10 million in the base that we had put in the prior year and did it one time. We put it back into the base, but we still are not, we're still withstanding part of the transfer. So if we say housing is one of our top priorities, it's awfully hard to say, well, we're gonna add on or spend or do something new if in fact keeping people housed or getting housing and dealing with it is our #1 priority. So I don't know when that report will be out, but I think it's something, and I think the hard part, and I struggle with this, is some of the thinking that we have and the information we have makes us kind of say, well, how could we possibly, but in the absence of knowing what we have for, how well are we doing, how well are we funding what we have committed, should we not be funding that? We had the issue around the state college transformation plan a couple of years ago. Remember, the governor didn't include the bridge funding. It didn't come over in the House. They increased the base. We put in the bridge funding saying, you know, we had a commitment here to get that system stabilized. So I think it's always a challenge to create that better understanding of, if you put your dollar here, then what you're not doing over here, because unless you have that information, you don't have any context to evaluate that. And I've found people will come in and present the merits, and the issue isn't the merits at all or the value. The question is would that be where you see that first dollar should go? And where are, those competing priorities and how do we stack them up? I think the judiciary, Dick, has got probably a long list of what they feel they need is necessary to operate their system. I suspect that we're going to see some of our, core service programs that serve vulnerable Vermonters level funded. I'm not sure. So I think as we look at the work ahead of us and some of the expectations and how we get them into alignment.
You haven't even mentioned healthcare. And I would say in my county, 913 hospitals in deficit. My FQHC just passed a budget that is in deficit by millions. And they just shrunk my nursing home. And when I look at all of that together, it seems a lot more fragile than I've ever seen.
Well,
Collected.
I would agree, and there are some providers that through just oversight didn't get included for the reimbursement increase, and that brings in several million, and I think the goal, there was a desire that somehow we would fund it in the budget adjustment, that group that was out. Whether that can be done or not, I'm not sure. But yes, the margins on hospitals are very, very, very skinny. We do have a report on the FQHCs, and it would be millions of dollars that they want, but that's going to cost base, which comes with its own challenges. You actually have to have rate setting if you're
No,
going
I'm not saying, but when I see a budget that passed by FQHC and in my little county passed a budget, it is millions of dollars in deficit. I'm sitting here going,
Well,
the whole
then you're building a budget on reserves because otherwise you can't pay your bills.
Right.
Well, the money in the system perhaps can be better utilized. We know that some of our private independent practices for physical therapy or for primary care are equally stressed.
Yeah.
And that's been going on since prior to COVID.
My FQHC has all the primary care practices.
Right, and so making more equitable reimbursement does two things. One, it makes greater access for patients, and two, it improves stability within the financial sustainability for hospitals and other practices.
So I'm sure we're all going to be bringing all those issues here, and I guess the only reason that I'm sort of expressing what the next couple months look like is how we create that understanding. Of course, there are people say, look, I'm going to put it out there and I'm good because I know you're going to have to say no, and somebody ultimately has to if we're going to get a balanced budget, but it's going to be a lot of competing priorities, and so I think that report, maybe we should even think about doing it at a caucus or something, giving it out and talking about how it really is it's a barometer of how well are we doing, or have we got commitments that we want to discontinue. But some of those are kind of, I think you'd find most of them are not ones that you would say you would want to jettison.
Who's doing the report?
It comes from the administration. So it includes everything from funding to if you're fully funding VHCB to what if you're going to pay 100% of you for the reach up program. There are a number of items.
Gresham shop or where?
What?
Gresham or?
The same, well, he gets it from the various departments. What it would take to fully fund, say, the transportation need versus what we have. I think that's like a $200 million shortfall. So it's very significant amounts of money in total, but it kind of gives a sense of, so I would encourage anybody, and I have to say the reason that bill, that report got put together was actually someone who was representing was advocating for something, and he said to me, it really would be helpful, because all I see is what we're asking for, and I don't have a sense of what it looks like in total, and it really would be helpful. And so I thought, you're absolutely right, it would help us too. So, sometimes we ask for reports and they don't have they collect dust.
Shocking.
Well, they're shocking, right? So,
And do you know when
no,
you're
I'm not,
expecting it to come?
I'm not sure when, maybe that's something you could put on the list to follow up on, if you would, Amy. So Dick, we've always got judiciary, Nada's got a request on some, education support for attorneys that I think are, maybe not pro bono, but I'm not sure.
Yeah.
Off the top of my head, but anyway, anybody who's got a request, we're gonna have to compile a list, and then we'll have our public hearings. And, for anybody who's listening and hasn't heard it before, those requests usually exceed available revenues by $400–500 million. So, this is the world in which we have to work.
Do we get a report of where we appropriated money but hasn't been spent, or none of it's been spent?
Yeah, we're gonna be really taking a hunger.
Yeah, so that we can reassign some
We
of
do that all the time.
Yeah,
We do that all the time. But with the ARPA money, it's going to be really important because we have deadlines or we lose it.
Yeah,
And so that's gonna be one of the areas that we're gonna be, as a committee, and if in your particular area, if ARPA money's gone out and it's December 2026, I think, to make sure that it's in fact, because we have redirected and we will have to make sure that it gets appropriated and redirected, because our goal is to make sure it's all spent. So that's one area, but there is a whole process. If in fact we appropriate something more and it's not going to be used. On the other hand, sometimes it's timing and it's called we allow it to be carried forward because a project may take a little bit longer or whatever. That's something that we do routinely.
so is that something that, like, some of us are chairs of committees, is that something we should be pushing our areas of like the ag agency?
You mean in terms of asking for what they've got for ARPA grants, yes, you should be, yeah.
In ag, and then we could bring it here?
Well,
or we'll get it here anyway?
we'll get it here anyway, but I think you could be getting a sense so that when we're talking about it, you've got more maybe detailed information. I'm sure we've got money in the courts. So we really need to, and the administration's got a sheet that they're tracking so that we can see, and sometimes we discover, and we've actually brought money back in and then reappropriated it.
Yeah.
Go ahead, Mayor.
Well, I think the courts will have large numbers, but we'll see what happens, but at least they appointed new judges and that will cut
The back.
some of the backlog. We have a meeting next Wednesday with the House Judiciary Committee on the backlog, and I'll know more then about what they're requesting. But I actually do have seriously, I would like to see another $5 million going to community violence prevention programs. And that first $5 million, they had 37 requests and only were able to fund 15 on a 2-year basis. I did ask them to look at what federal money might be available.
I thought that was anticipated.
Right. And evidently they haven't looked at that. So if we could get an update from the administration.
They haven't looked at it?
Not given the emails back and forth between myself and the administration, I didn't see anything.
Because that was very much a part of our discussion,
Yeah.
was that those federal funds.
From the Safe Street.
Yeah.
So you could check with the administration on that.
The status.
But I would like to see another $5 million go into it, but if it could be federal money, all the better.
I think that was our hope.
Yeah, because originally we I requested 10 million.
I know, the
That's right.
Sears grants, we know.
The governor appropriated 10 million. The House cut it to
And we agreed.
And the caucus
Well-
committee agreed, right?
5. Yeah, and I don't know who was on that
Yeah.
conference committee. I can't imagine them selling us out like that.
Oh.
So the other area that, for me anyway, my experience is this summer and fall. There's a huge deficit in employees for some of the social service agencies like VNA, hospice, even by
Residential care.
residential care. And they're going up to try to get to $20, but the person doing that work can get $20 at McDonald's.
And they have master's degrees, a lot of them, like the
Right.
master's in counseling is being devastated. as a
Right.
result.
So, I don't know, I realize it's a tight budget year, but when the governor talks about affordability, I think we are going to price ourselves right into huge Medicaid gaps as our senior citizens try to stay at home under the current, I was lucky that I was able to take care of Bev and have staff, but some of the people that came were inadequate. I ended
Or
up
they didn't
doing more,
come, or they
or they
didn't
didn't
come.
come. And honestly, I had better results from BIATA, the professional, than the nonprofit VNA because I just don't think they could hire the staff. So, it's kind of, I just see it as we have an aging population. And our nursing homes are about 80 to 85%.
Right, they're dropping like flies,
Yeah.
residential care facilities, and
Yeah.
then the putting resources into SASH or Choices for Care to keep people at
Yeah.
home. Yes.
But you can't keep people at home if there's
No,
nobody
if
to
you
care
don't
for.
have people who can come in.
Right. And so I think we're building ourselves to a crisis.
It is a crisis.
Or it already is,
Yeah.
yeah. I mean, obviously.
Geez, I feel like I should slit my wrist and go home now.
Well, you might need to. No, I seriously.
No, I really think what we're trying to do is be honest about all the things that are converging that really are going to affect the lives of so many Vermonters.
Well, I think in the long run, it's gonna cost us more money because more people will be in nursing homes or long-term care situations using.
I have another little factoid for you that is very scary, and that is the gap, the workforce gap. I was talking with folks from the Department of Health about this very issue. And one of them had gone to a national conference, and included in that was workforce. When will we see sufficient workforce to take care of the issues that you're talking about and others? The 12 to 15-year gap. So we won't catch up for that period of time, which means we're going to be having the same discussion for the next 12 to 15 years. But it is really scary.
Well, I thought one of the things that was interesting in the all legislative briefing day, and that was the extent to which Maine had actually had attracted workers into the state. And I think we had very large ethnic groups that I think are in Lewiston or Auburn area.
That's right.
And they had, and so they had made some growth in terms of how they recruited and engaged that group of workers.
Are we
And
talking about immigrants?
Yeah,
uh-huh,
And most of the problem there is federal.
I know.
and
And,
housing.
Housing,
and
housing.
well, it's housing and that, but it's mostly federal. When I was a kid, a lot of the nurses around here were Filipino, and you can't do the same things that you do.
Well, of course, the other thing is, years ago, we didn't rely just on the academic approach to training our nurses. The
Yeah.
hospitals had really
Right,
onto our
exactly.
wonderful RN programs. They all got shut down, and we constrained the numbers. And I was telling Jimmy, I read the article in and this has nothing to do with Senate appropriations, but to me it brought home, what are the decisions we make today and what are the long-term implications? Because sometimes we make decisions that might be expeditious, and I worry about that with the hospitals. You have no margin, but we want you to shave off, $5 million or something. So they had a man by the name of Abraham Flexner, and he was a consultant on how to reduce the cost of higher education. This is around the early 1900s. And he was recommending one way to do that is shut down your medical colleges. And in New England, he was saying there should be only two, and that should be Yale and Harvard, I believe. UVM had a medical school, Bowdoin had a medical school, as did Dartmouth. Bowdoin closed theirs. Dartmouth went for 60 years. They only had a 2-year pre-med, and then you had to transfer. My cousin was in that and had to transfer, I think, to Harvard to finish up. Now, 60 years later, they restarted their MD program. But around the country, a significant number of medical schools closed. Many of them trained Black physicians or people, minority populations. And you think a decision made a century ago, and the implications it's having in terms of the shortage of primary care physicians who are trained and part of those ethnic communities in terms of their health needs and the culture. And so we saved money and we shut down, we constrained the supply, and what are we seeing? And so I sort of think that's another element. What is that long-term implication? And I think that's really what you're getting at too, Dick, in terms of what does that planning look like? And that gets into our whole discussion about how we're dealing with healthcare.
It's what we've been talking about. What I've been concerned about is putting your finger in the dike versus establishing change for the whole thing. And so short-term solutions don't always result in long-term systemic improvements.
But that's hard in a political environment.
And it's very difficult because everyone is coming to us with a need for instant improvement. And we all have our constituents who are asking us to represent them to do that. But I think we have to take a step above and start thinking about how can we think long-term and put some policies in place that maybe the Titanic won't turn right away, but over the next few years it will, and we'll avoid that iceberg, or at least we'll get scraped less than we would have otherwise.
Or at least we'll have a door that we can.
We have lifeboats.
Lifeboats.
So anyway, we're gonna have some interesting work ahead, and if people have got priorities, we can, put them on the list, and we'll see how we can make it all work. And it's really gonna be what are the core responsibilities and how well we're doing, and setting those priorities.
So in some ways, that is exactly what's happening right now with Act 167 and healthcare reform. It's a sluggish, not really
Can we
sluggish.
come up with a new word? We've been reforming for the last 20 years.
Okay,
Jenny.
healthcare improvement.
I think that would be
Systemic
good.
change. Okay.
I don't care.
Revitalization.
We're revitalizing. I like that one even better. We're
That
revitalizing.
assumes that we
That we're vital.
We were vital at one point.
we were vital at one point, but now we need to.
Now we're revitalizing.
Okay, so we'll trash that word.
I know exactly what you're talking about. It's just, it's actually something we should be doing all the time, and that is, what needs to, how do we change what we're doing? Oftentimes, I think we layer it on, and we never discard, we just add on, and then we can't figure out what we've done.
Well, this whole discussion about a women's prison is an interesting concept of this whole do we build a prison that's so big that our projected trends are, or do we build something smaller? Because obviously the bigger you build it, the more it's gonna cost to operate. And I just, it's just what you were just saying about taking into consideration long-term benefit. It's and obviously the administration's at one end, and the House institutions and corrections and institutions committees and then our institutions committee will deal with it after they do. And let's see, it's gonna be an interesting drama.
And the programs and the services that are available in there, something we should all be concerned about.
Is that you?
Yeah,
Oh, my goodness.
wow, my first of the year.
So until, let's see, tomorrow, we just had the governor's speech, so we're not gonna meet after that. And then, that will bring us to Friday, and what we have scheduled is Amy's just gonna give us sort of the, cliff notes on the budget adjustment for this fiscal year. And that'll finish this first week. And if there's anything, that comes up or whatever, let me know. Otherwise, I'm going to suggest that we adjourn the